Hello everyone, my name is Sherifat Abdusalam. My badge is here. I'm here today to perform wound hygiene using sterile clothing. First thing I've done is to gather all my equipment. I have an extra glove here. I have my sterile dressing here with the sterile glove in it. I have my wound section. I've already put a band-aid over the wound to show that it's an existing wound. I have this bag. It's also red, so it shows that it's a biohazard bag. I have a sanitizer here for extra hand hygiene, and I have a Sharpie here to label the dressing once it's done. I'm going to perform hand hygiene first and then go into my patient's room, provide privacy. I'm going to introduce myself to the patient, identify the patient two ways with their name, date of birth, and also with a wristband. Then I'm going to explain the procedure to them, seeking their consent and also their support while providing care. The next thing I'm going to do, I'm going to take off this badge. I don't want to contaminate the sterile section. I'm going to take off the whole wound dressing, wear my regular glove. Once that is done, I'm going to carefully remove the band-aid from the wound, parallel to the wound this time, because I don't want to pull the patient's skin and I don't want to pull the skin around the wound as well. Gently remove the patient's wound. I'm sorry, Mrs. Smith. I'm sorry, it's painful. Sorry about that. Once that is done, I'm going to pull the band-aid away from the wound, remove my glove, remove my soiled glove, and toss that into the biohazard bag. The next thing I'm going to do, permit me to scoop to the side because I'm going to start the sterile dressing. I'm moving because I have limited space. I'm moving the wound and the sterile bag a little so I can do this. So the first thing first, I'm going to perform another hand hygiene, and I'm going to hand hygiene done, and I'm going to start the sterile process. What I'm going to do here is I have my extra 2 inches to open the sterile dressing. That is done. I'm going to carefully remove the sterile gloves without contaminating the surface. While I have access to that, I'm going to push the sterile pack away from me so I can have enough space to perform my sterile dressing. While I'm doing this, my hand is raised up and the other hand has not left the sterile gloves that I'm holding. I'm going to use the 2 inches at the end of the sterile glove opening. My left hand is my dominant hand. Pinch the outer surface, slide that in. Scoop my hand into the other glove. Then wear. Making sure it is not contaminated. Once the sterile glove is done on, I'm going to take my pack, toss it into the trash, use my sterile hand, move the dressing back to me without contaminating the sterile area, and then I'll now start the wound care. I'm going to use my dominant hand to take the stick with the cleaner, and then I'm going to drop that into my hand. Use that same hand, clean the wound inside out. Start from the inside and then go out to the outside, from inside to the outside. Drop that into the biohazard bag. Next thing, I'm going to take the 2x2 gauze, drop it back into my dominant hand here right now, and I'm going to pat the area dry. Sorry, Mrs. Smith, are you okay? Pat the whole area dry, ensuring that the whole surface is dry. Drop that one as well into the biohazard bag. Before I apply the dressing, I'm going to assess the skin, check the skin integrity. I'm going to press the surface area gently. I'm trying to look for any drainage, any coloration, if there's any foul odor. I'm trying to assess all that. Once I establish everything is fine, even I can even measure the tape to see how, measure the wound with the tape to see how the wound is healing. I can do that as well. And once I establish that, I'm going to take the dressing, and with that, I'm going to take that off. So I'm going to apply that gently over neatly for remediation purpose, just in case I'm not taking off the whole tape at the area, because just in case there is a remediation, so I don't lose the whole integrity of the tape as well. Once I've established the tape is clear on the skin, there is no hair or bubble around it, everything is smooth, I will now take off. I've completed my sterile dressing at that point in time. Then I'm going to dispose of my sterile glove, pinch the sterile glove, pull away from my hand, roll into a ball, use my 2 fingers, scoop the other one, roll, throw into the trash. At this point, I'm going to perform hand hygiene before I touch the client, because I don't want to transfer any latex from the glove to the client. Once that is done, I'm going to label the dressing with my initial, the date, and the time that it was applied. Once I've done that, I'm going to clear the area of any extra trash or any the biohazard. Everything will be cleared from the area. I'm going to place the patient back in a comfortable position, put the call bell, the call lights close to the patient, their table, everything is set around them, make the patient comfortable, ask if they're comfortable. Are you comfortable, Miss Smith? Is everything okay with you? Once the patient confirms they are fine, I'm going to exit the room and go and complete my documentation. Thank you.